Hello everyone and welcome back to Nurse Quiz Corner. In today's video, we will be diving into pharmacology practice questions to help you master key medications and their effects. So whether you are studying for your nursing exams or just brushing up on your knowledge, these questions will definitely test your understanding of critical drugs and their impacts on patients. Let's get started.
1. A patient is prescribed digoxin for heart failure. Which lab value should be closely monitored? Sodium B, potassium C, calcium D. Magnesium answer, B. Rationale, low potassium increases the risk of digoxin toxicity. 2. Which instruction is important for a patient starting on warfarin? A. Avoid leafy green vegetables. B. Take it on an empty stomach. C. Double the dose if missed. D. Increase fluid intake. Answer. A rationale. Leafy greens contain vitamin K, which can reduce warfarin's effectiveness. 3. A diabetic patient is prescribed metformin. Which side effect should be reported? Headache B. Constipation C. Shortness of breath D. Blurred vision answer. C. Rationale. Shortness of breath can indicate lactic acidosis, a rare but serious side effect of metformin. 4. A patient on ACE inhibitors may report which side effect? Diarrhea B. Persistent dry cough C. Rash D. Sweating answer. B. Rationale. ACE inhibitors can cause a dry, persistent cough due to bradykinin buildup. 5. What is the primary action of beta blockers in hypertension management? Increase cardiac output B. Block epinephrine C. Decrease fluid retention D. Increase blood pressure answer. B. Rationale. Beta blockers reduce heart rate and lower blood pressure by blocking epinephrine. 6. Which symptom might indicate digoxin toxicity? Nausea and vomiting B. Insomnia C. Muscle spasms D. Sweating answer. A rationale. Nausea and vomiting are early signs of digoxin toxicity. 7. Which lab value should be monitored for a patient taking lithium? Sodium B. Calcium C. Magnesium D. Iron answer. A rationale. Lithium levels can be affected by sodium levels, and monitoring helps prevent toxicity. 8. A patient with asthma should avoid which class of drugs? ACE inhibitors B. NSAIDs C. Beta blockers D. Diuretics answer. C. Rationale. Non-selective beta blockers can worsen asthma symptoms by causing bronchoconstriction. 9. Which is a common side effect of opioid analgesics? Diarrhea B. Increased heart rate C. Sedation D. Rash answer. C. Rationale. Opioids can cause sedation and drowsiness. 10. What is the antidote for acetaminophen overdose? Naloxone B. Vitamin K C. Acetylcysteine D. Flumazenol answer. C. Rationale. Acetylcysteine is used to counteract acetaminophen toxicity. 11. Which instruction should be given to a patient taking levothyroxine? Take it with a meal. B. Avoid dairy products. C. Take in the morning on an empty stomach. Split the dose throughout the day. Answer. C. Rationale. Levothyroxine absorption is best on an empty stomach. 12. A patient is prescribed nitroglycerin for chest pain. Which statement indicates understanding? I should chew the pill for faster absorption. B. I will take it with milk. C. I should keep it in a dark container. D. I should take it only at bedtime. Answer. C. Rationale. Nitroglycerin should be stored in a dark container to prevent degradation. 13. What is the therapeutic range for INR in a patient on warfarin? 1.0 to 2.0 B. 2.0 to 3.0 C, 3.0 to 4.0 D, 4.0 to 5.0 Answer, B. Rationale. An INR of 2.0 to 3.0 is therapeutic for most patients on warfarin. 14. A patient with hyperthyroidism is prescribed propylthiouracil, PTU. Which adverse effect requires monitoring? A. Weight gain. B. Diarrhea. C. Agranulocytosis. D. Rash. Answer C. Rationale. PTU can cause agranulocytosis, which is a serious condition. 15. Which drug is commonly prescribed for Parkinson's disease? Alprazolam. B. Levodopa-carbidopa. C. Phenytoin. D. Lisinopril. Answer B. Rationale. Levodopa-carbidopa is used to manage symptoms of Parkinson's disease. 16. A patient on corticosteroids should be monitored for which side effect? Weight loss. B. Hyperglycemia. C. Hypotension. D. Bradycardia. Answer B. Rationale. Corticosteroids can increase blood sugar levels. 17. A diabetic patient taking insulin may need to increase their dose in which situation? A. When fasting. B. During illness. C. When exercising. D. After losing weight. Answer B. Rationale. Illness can increase blood sugar levels, requiring more insulin. 18. Which is the primary action of albuterol? Anti-inflammatory. B. Bronchodilation. C. Mucolytic. D. Antihistamine. Answer B. Rationale. Albuterol is a bronchodilator used in asthma. 19. A patient is receiving heparin. Which lab test should be monitored? A. INR. B. PTC. APDDD. Platelets. Answer C. Rationale. APTT levels are monitored to assess heparin's effectiveness. 20. Which symptom indicates aspirin toxicity? Hearing loss. B. Rash. C. Constipation. D. Sedation. Answer A. Rationale. Tinnitus or hearing loss may indicate aspirin toxicity. 21. A patient taking furosemide should be monitored for hypercalcemia. B. Hypokalemia. C. Hypernatremia. D. Hyponatremia. Answer B. Rationale. Furosemide can cause potassium loss. 22. Which lab value should be checked before administering erythropoietin? The WBC count. B. Hemoglobin level. C. Platelet count. D. INR. Answer B. Rationale. Erythropoietin increases red blood cells, so hemoglobin should be monitored. 23. A common side effect of ACE inhibitors is hypokalemia. B. Cough. C. Weight loss. D. Drowsiness. Answer B. Rationale. ACE inhibitors can cause a dry, persistent cough. 24. What is the action of statins? Lower blood pressure. B. Increase HDL levels. C. Lower cholesterol. D. Increase heart rate. Answer C. Rationale. Statins reduce cholesterol to prevent cardiovascular disease. 25. What is the antidote for heparin overdose? A vitamin K. B. Protamine sulfate. C. Calcium gluconate. D. Activated charcoal. Answer B. Rationale. Protamine sulfate reverses heparin's effects. 26. A patient on benzodiazepines should avoid alcohol. B. Dairy. C. Carbohydrates. D. Fiber. Answer A. Rationale. Alcohol can increase sinus depression when combined with benzodiazepines. 27. Which class of drug is commonly prescribed for hypertension? Anticholinergics. B. Diuretics. C. Antihistamines. D. Opioids. Answer B. Rationale. Diuretics help reduce blood pressure by lowering fluid volume. 28. For which condition is methotrexate commonly prescribed? Asthma. B. Hypertension. C. Rheumatoid arthritis D. Diabetes answer. C. Rationale. Methotrexate is an immunosuppressant used in rheumatoid arthritis. 29. What is a primary concern when administering opioids? Increased blood pressure B. Respiratory depression C. Hyperactivity D. Rash answer B. Rationale. Opioids can cause respiratory depression, which may be life-threatening. 30. The patient on spironolactone should avoid excessive intake of calcium B, potassium C, magnesium D. Sodium answer B. Rationale. Spironolactone is a potassium-sparing diuretic. Too much potassium can lead to hyperkalemia.
Thank you for watching. I hope these pharmacology questions helped you feel more confident in your studies. Be sure to like, subscribe and click the bell icon for more nursing exam prep. Keep up the great work and I'll see you in the next video. Bye for now.